Good morning, everybody. Can you all hear me okay? And thank you, Colette and Patrick, for your introduction and for your kind words, Charlie. And it's a great pleasure for me to be here with you this morning. And as it's been said, I've just been appointed as Head nationally of Mental Health Engagement and Recovery. And this is actually my first, I suppose, public and official duty in that role. And it's kind of fitting that it's here in Roscommon and in Athlone in CHO2. It's not quite Mayo, but I hear from noble Roscommon men in the room like Porrick that I'm very welcome. And in 2013, in June, we had our first ARI learning set at the time, and it was also in Athlone. And we had about 50 people in attendance, and that was a national learning set that day. So when I look around now, maybe we're not doing too bad. I think that. And the question I was asked by Aisling to talk about today was, what exactly is mental health engagement and recovery? And maybe actually the answer is in this room when I look around. And a few years ago, I was in another service in another part of the country, and we were talking about recovery and involving service users, family members, carers. And the reply I got was, well, where would you get them? Where would you find them? We can't get any service users or family members to help us out. So maybe I'll just have a quick straw poll here now. Would everybody who considers themselves a family member or a service user or supporter in the room please raise their hand? Wow. So you're all very welcome. It's great to have you here today, and thank you for coming. And I don't know if many of you here are into movies, but there was a movie one time called Field of Dreams with Kevin Costner. And the story of that movie is, for those who don't know it, that he had a vision. He was a cereal farmer in the deep south of America, in the Corn Belt. And he had a vision, and he heard a voice, imagine. I don't know, were they dusting down the Mental Health Act or the DSM? And he was told that he was to build a baseball field, and everybody thought he was nuts. And as the film went on, he did build the baseball field, and the final scene of the film was that the baseball field was full with people playing and watching. And what the voice told him that he had heard was, build it and they will come. And so maybe in the last few years, that's what visionary people in the HSE have been trying to do. And they've tried to set up structures like Advancing Recovery in Ireland, like mental health engagement, like the Service Reform Fund, like recovery colleges, like peer support working. And what's happened? This has happened. Ye have come. And it's not just service users and family members who are here today, because we can't do this without professionals. So could I have another show of hands for everybody who works in the HSE or in an NGO, please, who's here today? So I think that's about half and half. So you're all very welcome as well, because we can't do it without both parties. And I suppose maybe that's what mental health engagement and recovery is about. It's about, together we can make it happen. And my role in my new position will be to ensure that all those functions of recovery, engagement, ARI, SRF, all work together in a co-production manner with services, so that together we can make it happen. And as over the next year or so, hopefully there will be evidence of that happening. So So that's really all I have to say, except to say that it's an absolute privilege and pleasure to be here today. It's an absolute privilege and pleasure to be in this role, and one that I will take very serious, because I want to see us, develop the best possible services we can, so that people who use services, be they service users, family members, carers, can have the best experience of using mental health services in Ireland, and that people can have the best opportunity to recover, whatever that recovery may mean to them. So thank you very much, and enjoy the day, everyone.